မင်္ဂလာပါရှင် Weekends with စစ်စစ်တာချုံအစီအစဉ်မှာကြိုဆိုပါရစေကျွန်မစစ်စစ်တာချုံဖြစ်ပါတယ်မြန်မာနိုင်ငံအပါအဝင်ကမ္ဘာပြည်သူတရက်လုံးကျန်းမာရေးအရာရောလူမှုရေးစီးပွားရေးအရာပါစိန်ခေါ်လျက်ရှိတဲ့ COVID19 ကူးစက်နိုင်တဲ့အဆုတ်ရောင်ရောဂါနဲ့ပတ်သက်ပြီးကမ္ဘာကျန်းမာရေးအဖွဲ့ WHO ရဲ့ဌာနေကိုယ်စားလှယ် Dr. Stefan Jost နဲ့ဒီနေ့အစီအစဉ်မှာဆွေးနွေးသွားမှာဖြစ်ပါတယ်မင်္ဂလာပါ Dr. Jost Thank you so much for taking the time to join us on the show. I know you're extremely busy. Can you share with us the broad overview of the situation and the efforts that's being made to identify and to contain the virus?
Thank you very much, Susu, for inviting me to speak, to comment. It's an important time for Myanmar and for the world to deal with the pandemic of COVID-19 that is obviously affecting the whole planet. Pandemic has been actually accelerating globally in recent days, with the epicenter in Europe now. Originally it was in China. And importantly, there are strict measures underway, both in European countries and elsewhere, to grapple with the situation and turn it around. For Myanmar, 3 cases have been confirmed. They are all doing well. As far as Minister of Health and Sports is very much on the job and has done a very proactive set of measures right from the beginning. The national health authorities have stepped up surveillance on the land border as well as the international airports, Yangon, Mandalay and Naypyidaw, and at the seaport, and have really put the preparedness in high gear throughout. There's also been a close collaboration between Minister of Health and Sports and WHO and many partners. It's really not confined to health alone. As you have mentioned in your question, the intersectoral committee is very important in this regard, and Myanmar is actually to be commended for having established that interministerial committee at an early stage. When WHO in fact declared globally the novel coronavirus, COVID-19, as a public health emergency for international concern, this was on the 30th of January in the evening. Within hours of that, Myanmar set up this interministerial committee, initially chaired by 2 union ministers for international cooperation and for health and sports. And this committee has since been further upgraded, and all the key ministries, intersectoral ministries, are part of it. And it's been further upgraded to be led by Madam State Councillor, Aung San Suu Kyi herself. So Myanmar is to be commended for the early actions taken and the proactive nature of the preparedness.
Because it goes beyond health. You were also mentioning that there were additional partners. So would these partners be civil society, or who would these additional partners?
Actually a whole range of partners. First and foremost, the UN system itself has been activated for this and is working towards strengthening the preparedness and response effort. But many international, bilateral, multilateral organizations and non-governmental organizations, civil society is also very much involved.
So would you say that the systems and the processes and the entities that are now engaged to combat COVID-19, the system is quite robust? Would that be a takeaway?
There is certainly a strong effort in that regard, both on preparedness and also in terms of response. As far as the 3 confirmed cases is concerned, for instance, it's noteworthy that they have been swiftly also isolated, and the contacts are being traced, who are also in quarantine, which is the right thing to do, to detect cases, isolate them, follow the contacts, and make sure that we can stop the chains of transmission, if there were any, in order to contain this outbreak. So the Minister of Health and Sports is doing the right thing in that regard, and has had and continues to have robust measures, particularly for the public health preparedness and response.
Many of us cannot differentiate between a common cold and COVID-19 because the symptoms that we have learned to understand of COVID-19 is very similar to a common cold: sneezing, coughing, slight fever, So do we need to be actually tested to identify whether we have a common cold or whether it's much more severe and it's COVID-19? Can you help guide a layperson like myself?
Well, first of all, COVID-19, although contagious, is not necessarily very serious. It can be, but in the large majority of cases, it is a mild infection, and it's only in a minority of cases where it becomes severe and needing further support and treatment. What is important, though, is to isolate cases once they are identified early, so that there are, to the extent possible, no further chains of transmission, because then the risk is that people who might develop a more severe form of the disease would become infected. And here the elderly are overall more at risk, but it can affect actually people at all different ages.
So the myth that once you contract COVID-19, that's bound to lead to fatality is absolutely not true.
That's right. While some cases can be fatal, it can be severe. In the large majority of cases, that is not the case, and it would be a mild infection. In fact, one of the 3 confirmed cases, also in Myanmar, doesn't have any symptoms at all. The person was picked up by the surveillance, which is strong, and it was a traveller returning from the UK, and it was part of the surveillance that is ongoing to prevent imported cases that it was picked up, which is very good. It means the surveillance is actually working, and congratulations for that.
Similar surveillance is being undertaken for the overland returns of Myanmar migrants.
Well, this is right, and it's a very important issue that you've mentioned. And here Myanmar really does need help and support, because it's an influx of a large number of people, and very important that all of us help Myanmar in this hour of need. I think that is an important issue of the day that we should be aware of, and we should help Myanmar best we can with personal protective equipment to keep our health workers safe, with oxygen concentrators and ventilators in case they are needed at the isolation facilities in the designated hospitals, but also other support to help in the contact tracing and in following up the surveillance that you have mentioned. It would be very good to do that and to support the community quarantine measures that the Ministry of Health and Sports and other sectors are undertaking for that particular.
Going back to the origins of COVID-19, which began in China in December 2019, as we all know. So despite the over 2,000 kilometers of highly porous and highly interconnected and border, why is it that no cases of infections were detected from such social closeness?
Sure, thank you. It's a very fair question. And it's important to remember that the combination of actions taken by Myanmar and by China were extremely important in this regard. Because China herself implemented a whole range of really aggressive public health measures. Rightly so, as it turns out, because China has been able to turn the epidemic around. And there has been a clear decline there in newly confirmed cases, a drastic decline in recent weeks, in fact. And also South Korea has been very successful in turning the situation around. So it can be done, and that's an important lesson for us all. As to the specifics along the border, what we know is that the Chinese New Year, for instance, was first of all extended. So people were actually away from their normal place of work for the Chinese New Year period. That was then also extended. And after that period is over, 14 days of quarantine was implemented by the Chinese authorities for the returnees to prevent exactly this happening, what you're mentioning. The Chinese authorities actually had effectively closed that border through the measures taken on the Chinese side, and thereby also providing protection to Myanmar from the Chinese side in terms of the possible importation of cases. And if you look at the data, the epidemiological data for Yunnan province, for instance, which is the large Chinese province contiguous to Myanmar, the total number of cases there, if I remember right, is 175, which is a fairly low number compared to the size of that province. It's almost the size of Myanmar.
In Yunnan. In
Yunnan province. And there have been no new confirmed cases, as far as I know, since the 21st of February. And the province also of Yunnan is far from the original epicenter, Hubei province, that is in the center of China. Just to maybe come back to your question on the symptoms, because perhaps we didn't quite address that properly. It's true, there is an overlap of symptoms between cold and common cold and the flu and also COVID-19. It's very important if one does experience any symptoms like fever, shortness of breath, difficulty breathing, dry cough, then of course contact health professionals immediately and also provide your travel history. It's important to be aware of what the travel history was. So that any association with perhaps presence in a country where there was local transmission, and indeed in the 3 cases that have been confirmed in Myanmar, there are 3 imported cases. So it would need to be, if you like, looked at by professionals